Hello everyone. Today we will be doing motor examination for spinal cord injury classification, that is Asia classification. So let's start with the C5 myotome. So my patient is lying supine on the bed and I will test his C5 myotome, that is his biceps muscle and his biceps brachii muscle. So let's tell the patient to flex. First we will tell the patient that his arm should be adducted and internally rotated and his shoulder should be in a neutral position. So at this position I will tell the patient to flex his elbow on his own. If he is able to flex his elbow, that means the power is grade 3. Next step would be, I will tell the patient, I will keep the patient's arm at 90 degree of elbow flexion. Now I will stabilize his shoulder and I will apply resistance on his forearm and I will tell the patient to flex his elbow against my resistance. If the patient is able to flex against moderate resistance, that means the power is grade 4. And if the patient is able to flex against strong resistance, that means his power is grade 5. So now grade 3, 4 and 5 have been done. What about grade 2? That is, the gravity is eliminated. So at this point I tell the patient to adduct his arm and internally rotate and also flex his shoulder so that his forearm is now resting on his own body. And at this point the gravity is eliminated. And I tell the patient at this point to flex his elbow and take it towards his arm. If the patient is able to flex the elbow, that means the power is grade 2. At last, I will check for grade 1 power. If the patient is not able to perform any of these movements, I will do passive flexion of the patient's elbow and will palpate for the muscle belly and the muscle tendon. If I can palpate the movement of the muscle or there is flickering of the muscle, that means the power is grade 1. Thank you.